Medical professionals of Reddit, what was a time where a patient ignored you and almost died because of it? I am a nurse and I had a very polite and lovely patient trying to remove all manner of chest tubes and IVs after a motorcycle accident. He was obviously delirious from the pain meds and the head injury, but very nice still. I left him in the care of my co-worker for my lunch. 10 minutes into my lunch break I see him stagger past the break room door like something out of The Walking Dead, trailing blood everywhere, only to collapse out cold a couple of seconds later. Said he needed the bathroom. IDK how the frick he pulled his own chest tubes out. Removing them always makes me cringe, let alone doing it to himself. He was put back to bed, this time in the ICU, and got some more sedation, and even though him ripping it all out set him back a couple of weeks, he still discharged and came to say hi and thanks on the way out. The happiest delirious patient I ever had. What a bloody trooper, haha. Had a post-cardiac surgery patient get out of bed, naked, and walk up to the front desk demanding to talk to the charge. Don't remember why. He unhooked his chest tubes from the suction. Surprisingly there was no bloody mess because he actually clamped them off. When asked about it later he said, well, I thought about pulling them out but it seemed like a bad idea. Had a throat cancer patient. We offered him surgery to remove the tumor. It was a fairly conservative surgery. He left because he didn't want a mutilating surgery and his daughter-in-law had been studying magnet therapy and she was quite good with it. His words. He came back a year later and was out of reach from any treatment. His cancer was so advanced that there was nothing we could do for him. Patient came in with syncope and general malaise. Found out she had a tiny patch of skin cancer on her ear, which she hadn't treated in over a year because she wanted to go to a different hospital to have it removed and just hadn't found the time. It metastasized to her brain, and I think other places. They gave her 5 months maximum. We had a college student come into the year and had a wonderful case of appendicitis. He needed to get surgery ASAP as surgery is way easier and safer if done before it ruptures. He called his parents to let them know and they told him to refuse because he had a test upcoming in the week and they didn't want him to miss it. He left the year against medical advice while we were all telling him that if your appendicitis gets worse and ruptures it can definitely lead to death. The kid luckily comes back about 10 hours later after it ruptured. He gets the emergency surgery and the amount of time he got to spend in the hospital probably doubled. Holy, those parents are beyond stupid. Had a repeat patient, not quite frequent flyer status. As a medic that would always call for a severe allergic reaction to shellfish every other month or so. She had always had the allergy and knew her reactions were getting worse. After a year, 6 or 7 calls of the silliness, my crew and I stayed in the hospital with her and talked at length about the situation since she'd always stay mum about how it kept happening. She told us she comes from a patriarchal culture and her father made this amazing seafood soup. If she didn't eat it and force her body not to reject his gift to the family, she would lose her car, phone, or whatever punishment her father deemed necessary. We pleaded with her to do whatever it took to show him it was deadly and carry her EpiPens with her. Fast forward a few years when I altered course into nursing and joined that saw a familiar bloated face. Turns out she had gone off to college in another state and hadn't been home for a while, but had visited her folks for a holiday. Of course she had the soup, and despite hitting herself with the EpiPen when her throat started tightening, the reaction continued. Her mom, who I had never seen before, told me she tried to eat it fast and rushed to the bathroom where she was found on the floor. Medics couldn't tube her in the field, so tried medical management until they could drive her to our doc performed a tracheotomy at the bedside and she went to the ICU. Took a week for her to recover and I was told by the ICU nurses that her father finally got it, that her allergy was a real medical condition. Whoa, poor woman. Hopefully the father actually did get it because that is balls. Shellfish allergies are severe. Had a patient stop taking his heart failure meds in favor of drugs. Cause, you know, drugs makes the heart beat faster. Hahaha. We had a mom in the NICU who would constantly kiss her premature baby on the mouth. Several nurses educated her around why that's not safe for the baby, and thankfully documented their teachings. This was during cold and flu season, and became even more concerning when the mother was coming in with cold-like symptoms, coughing, sneezing and obvious congestion. She still continued to kiss the baby right on the mouth. The baby was almost ready to go home by this time, but got extremely sick. The baby ended up on a ventilator and had quite the extended stay with many close calls. I've read that the most common reason for a surgery to be re-performed is the patient not following doctor's orders during recovery. Doctor says, don't ride your bicycle for 6 weeks. Patient hears, don't ride your bicycle until you feel you can. Animal hospital professional. At least once a week we have to re-suture up a spay because the owners don't want to keep the cone on their dog cat and let them tear up their surgical site. Their organs are right there. Keep the dang cone on. I don't care how sad Luna is with it on. Then they yell at me because it costs money to sedate and re-suture an animal. Patient came to see me having a stroke due to a blocked brain artery. I'd activated the code stroke team. Everyone was ready in the theater to get the clot out of her artery. Nurses, anesthetist, technician, but she, 42, insisted on updating her Facebook status and checking in before allowing me to treat her. Wasted 5 minutes and 6-10 million brain cells, if she had that many to start with. Winner of the WTF award from me. Almost every day, you must not get up or you will die from embolus. Walks to bathroom to take a crap. Didn't die, but did lose an eye as a result. Young kid, 20, with bad diabetic retinopathy from uncontrolled DM type 1. Had eye surgery to remove blood and scar tissue from inside the eye. We told him to take it easy for a few weeks. He went to Six Flags. Roller coasters are bad. Retina completely detached. I got soft and painful. Had to be removed. I got soft. No. Please don't get up on your own. Then he gets up on own and pulls out line going into jugular that leads directly to the heart and proceeds to bleed all over everything until he pass out and almost dies. Again. No. No. One time at the VA after adult circumcision. Do not have sex or masturbate for 6 weeks. Decided to masturbate the next day. All stitches tore. When I was in medical school, had a gentleman in his late 60s come in for chest pain. Found to have a large heart attack. Very impressive STEMI and lad by EKG. Refused emergent cardiac catheterization, go through the arteries and put a stent to open up the vessel of the heart so he could bring his car home and planned on taking an ambulance back to the hospital. He was in the parking ramp and it cost $20 day to park. Came back by ambulance in full arrest, no pulse, and died. Doc had to call his son and explain what happened. He was like, yeah, that sounds like dad. He's always been cheap. Obviously what happened wasn't worth saving the $20, but that seems like really expensive parking. Friend told me a slightly overweight homeless woman was shooting in her butt and the spot was necrotic. She came in with sepsis and somehow standing and talking with what he could only describe to me as near full body organ failure. They stabilize her. Somehow she survives but is now missing half an ass. He said 2 years later she came back with her foot now rotting off from shooting in between her toes and on her ankle. Same condition, etc. Just now the leg. They amputate and he says somehow she survives again. Except 2 weeks later she is pushed back in on a wheelchair, drooling and nearly dead from overdose. Put an IQ. Son comes to visit her. At this point the hospital staff and my friend know her by name by the multiple visits. She hasn't seen her son in nearly a decade. He convinces her to promise to try to clean up for her grandchildren. Less than 24 hours later she ODs. Again, inside the hospital bathroom, somehow having snuck her kit in, nobody knows how. Friend said she was on the toilet with the needle in her arm, still warm, but very dead. Not necessarily the patient, but the caretakers at the facility where the patient was living. I used to visit different board and lodge facilities for adults with mental illnesses and meet with clients to discuss their mental health, help them set up job interviews, therapy sessions, and help them set up their medications for the week if they were unable to do it themselves. Most of these facilities were places for people who had left the hospital and were deemed independent and stable enough to have the freedom to come and go as they pleased in a shared living situation, much like a dorm. Despite having a place to stay and food provided, they were usually pretty poorly supervised by the mental health staff workers there. I often hated these places because, while they were ideal for some people who were truly getting back on their feet and thrived off being able to live a semi-normal independent life, They were way too lax for many of the sicker, more isolating patients who were not at all well and slipping under the radar. Some of this included them not taking their medication as directed, which was one of the requirements for keeping their housing, but unfortunately it was not strictly enforced. There was one man who had paranoid schizophrenia who was extremely quiet and kept to himself. I had met with him a few times and he seemed to be going downhill in his appearance and general mood. I spoke with his doctor and urged the facility staff to closely monitor him and his medication intake, as I saw in his logs that he often skipped coming in to get his medication at all. I was told that they were going to be sitting down with him to remind him of his living agreement and that he had 30 days before losing his housing if he wasn't med compliant. I was also told that his psychiatrist was aware and they may be sending him back to the hospital that week. Apparently this never happened and he went out into the community and acquired a knife and used it to slice up his roommate while his roommate slept. He carved him from mouth to ear and stabbed him in the stomach several times. The man survived the attack, but the man who had gone off his medication claimed he was being poisoned by his roommate through the window AC unit. For anyone with a violent incident like that on their medical report, it is incredibly unlikely he will ever be able to find a better rehabilitation house ever again that will accept him. The system basically screwed over 2 people that day, as the man who was hurt was already there for PTSD, and as you can imagine, it not only scarred him physically for life but exacerbated his illness with more trauma. That is terrible. Negligence created 2 victims and made them worse off. That is one of the worst stories on here. Doctor here. I had a patient who came in and on evaluation I determined that her diabetes was out of control by the look of her retinas, which required immediate intervention. I sent her straight to the retina specialist who then scheduled her for an OR. She decided that day not to go in because she had work and couldn't afford to take off. She was cleaning houses and the sprays made her sneeze, causing massive hemorrhaging in her eyes due to the weakened vascular state from the diabetes. She went immediately blind and got into emergency surgery that day. It took months of recovery and injections to reverse some damage, and she now, years later, has functional vision again. Her kidneys were also failing her and she had no idea. This kicked off a massive lifestyle change and a chain of doctor's appointments that saved her life, all starting from an eye exam. Patient was supposed to have starved for 8 hours for her morning scheduled breast surgery. During the procedure she regurgitated what can only be described as a full partially digested English breakfast, with identifiable sausages, egg, beans and possibly black pudding, up into her unprotected airway and attempted to inhale the lot. Managed to prevent the majority of it going down, but she needed HDU care for a day or so for her lungs to recover from the stomach acid. I used to work for a surgery center and the amount of morons who did this was astounding. There's a freaking reason you are told not to eat drink 8 hours prior to surgery. They have no idea about aspiration. When I'm told the 8-hour rule, I fast for over 12 hours. I dang well make sure there is nothing in my system to frick me up. EMT paramedic student here. So we had a patient who was morbidly obese and couldn't get out of his house. He decides after about 4 days of uncontrolled chest pain to call it in. Well, we get there and find evidence of several MIs but refuses care and wants us to leave. About 45 minutes later we get a call from the building he lived in and we got there and it was him in full-blown cardiac arrest. This man was so obese that we couldn't get him through the door and had to knock out a wall and lift him down off the 2nd story with a lift. All the while me and my paramedic lead were bagging him through an ET tube. Lots of firsts on that call. First ET tube I put in and first IO is ever seen done in the field. Butthole patient on a Centrimag. Basically a heart pump with hoses that draw blood from your heart into a pump next to the bed and brings the blood back to the heart through a different hose. As you could imagine, there is little room for movement since they could dislodge and you'd have blood squirting inside your body or outside. This guy was adamant he had to sleep face down. Well, he did, and then he died. I am on dialysis and one of the nurses told me about patients that after kidney transplants just will stop taking their anti-rejection meds after a few years because they think they don't need it anymore, and it's really frustrating for them nurses because the patients just ruined a donor kidney. Not a doctor, have worked in addictions field. Too many clients have died or will die because despite the repeated warnings from their doctor that they have almost no liver function or that what they're drinking is giving them all sorts of brain damage, they continue to drink hard. But a lot of these guys feel like they have nothing to live for but the bottle. It's really heartbreaking. This would be my father-in-law. At this point the alcohol is just slow working poison that is eating away at his body. You have been visited by the science doggo. Upvote now and you will get high grades and good results within the next week. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Or don't. Either way, have a great day you magnificent people.